Nobody wants to be defined by their illness. Treating people with respect and understanding and treating them as people is just so important. And I think getting to know them and understanding their behavior and what's behind it, understanding trauma, understanding their interests and their lives that they lived before this illness consumed them, helps people to relate and to empathize and to connect.
Every year, about 1 in 4 U.S. adults seek mental health care. Some are facing a crisis.
Thank you for calling 988 Lifeline. How may I help you?
Some are looking for stability.
For me, making pottery feels productive enough to be meaningful, but it doesn't feel like pressure, which is perfect for me when I was in the absolute pits of depression. Exercise also helped, as did gardening.
Some are searching for that quiet but powerful thing we all want. The chance to build a life that feels whole.
I feel emotions very intensely. And yes, the lows for me are incredibly low. But the love I feel with such intense emotion is so beautiful. And the happy moments are so much brighter.
But mental health care isn't just about treatment plans or diagnoses. It's about how people live, recover, and connect, and what it takes for them to truly thrive, not just survive. Julie Burton is helping the state of New York reimagine mental health through the lens of recovery and resilience. As the New York State Office of Mental Health's first ever Chief Recovery and Resilience Officer, she brings decades of experience as a social worker, intensive case manager, and champion for person-centered care. Julie's work has reframed mental health from the ground up, seeing people not as their diagnosis, but as full human beings with strengths, goals, and untapped potential. It's a shift that affects not just the people receiving care, but the workforce tasked with providing it. This is Empathy Affect, the Forsmarsh Media podcast that explores the human side of government. I'm Melissa Sosinski, and today Julie joins us to talk about what recovery really means, both within systems of care and in everyday communities. And we talk about something Julie thinks about a lot: how we can rebuild the everyday connections, those small human moments, to help us truly show up for one another. Julie, welcome to Empathy Affect. It's a pleasure to have you here today.
Thank you. It's great to be here.
Yeah. So you are the Chief Recovery and Resilience Officer for the New York Office of Mental Health. So I'd love to start by talking about recovery and resilience, two words that can mean different things to different people. So when you think about those words in the context of your office, what does recovery and resilience mean in practice for the people you serve?
Recovery from a mental health perspective really looks at the whole person, not just their symptoms or their diagnosis. It includes their health, their home, their relationships, any skills and strengths that they have, and is really all inclusive. All the things that are important to people in general. Nobody wants to be defined by their illness. So recovery encompasses all the other things aside from having the mental health diagnosis. And resilience, we often think of resilience as applied to children. We say children are resilient. They can bounce back. They don't always have control over their environment, so it's important for them to adapt. But it's equally applicable to adults, especially, when people have made progress in areas like dealing with their mental health. There's always going to be challenges. There are always going to be bumps in the road. We need to be able to cope and overcome and move forward. So if you've made some progress in your recovery, being able to bounce back from any challenges that come in the future is so important in order to maintain that progress and not start back from zero again.
Yeah. Piggybacking off of that, why would you say it's important to center recovery and resilience, not just treatment, in the mental health care system and how people experience care?
So the focus on treatment is really more of the medical model and the focus on the deficits and the diagnosis. That's important. We need to understand the person's illness, but it doesn't define the person. Those things don't define the person. They're a piece of what they are, who they are, not their entire identity. So when we look at a deficits perspective, we see the person as a patient more so and sort of forget about all the rest of their characteristics and the other things that make them up. And those are the things that really can help a person get through and, really enhance their recovery. And part of a recovery focus is having the individual make their own choices and decisions and set their own goals rather than it being enforced by the practitioner. So, in other words, you're deciding what it is you want to work on, what's important to you, rather than me saying, Melissa, you need to take your medication and go to group, right? That's not really a goal for life. That's a means to an end. And when people have choice in their lives, it's more likely that they'll be invested and more likely that their progress will stick and that they'll have greater community tenure, a longer standing recovery than they would have if it was just imposed on them. So often the recovery model is pitted against the medical model, and I really try not to do that. They're both equally important. There's room for both for them to sort of live together and treat the whole person.
Yeah, it really does look at a person as a whole too, which I appreciate you sort of bringing that to light. I would like to note that you are the first Chief Recovery and Resilience Officer at the Office of Mental Health in New York. So please share with us why the office decided to create the role and what does it signal about the direction the state is heading in its approach to mental health?
Recovery and resilience have always been priorities for the agency. It's not as though they didn't exist before this role came to be, but they were kind of integrated and weaved into all of the other programs and things that we were working on. So we wanted to have a more distinguished, dedicated, focused way to ensure that recovery and resilience are at the foundation of all that we're doing as an agency. And by having one single person responsible for that, we can ensure that there's a more universal approach across the agency. And we've been really fortunate as far as the direction of the state. We have really been invested in over the more recent years. We've been able to provide more services for New Yorkers. From my perspective, this is just so important in today's political and social climate when stigma and judgment toward people with mental illness is so prevalent. There are so many degrees of involvement that you can have with mental illness. We can't pretend that there's a complete and separate population from the rest of us. So looking at the mental wellness of the state and how do we support people in general is as equally important as opening a new inpatient bed. And we've been able to really come at it from all of those different directions.
Yeah, I love that, you've been able to bring this into the office and sort of lead the way that, we can, at least if I haven't already start thinking about it, start reframing. And now that you've been in your role for a little bit, would you like to share some of the priorities you've brought into this position and for the people of New York?
Sure. So the way the Office of Mental Health is organized, we directly operate some of our own services, and then we license, credential, oversee other services that are being operated in the community by counties or providers. And our state operated services tend to serve individuals that have more serious mental illnesses or more severe difficulties because of their illness. That population has been my priority because they're often what we think of as the face of mental illness, and they're also most often misunderstood and misrepresented, which leads to increased stigma toward them. So often they have lost many of their natural supports and hoped for themselves. So focusing on that group of people has been my priority because they really have been marginalized and don't often see their own ability to recover.
Mm. With some of those priorities in mind, where are some of the opportunities or even challenges alike in realizing recovery and resilience in New York's mental health systems of care?
The opportunity has been incredible. The service providers, the leaders of the agency and our hospitals, our programs, the individuals in care, the direct care staff are also excited about this. Anytime I talk to any of them, that you can see that it really hits their values or their mission, the reason that they've gotten into this business. So I think that people are ready. I think that there's a passion and investment in focusing on improving our recovery-based care. The challenges, one of the more direct challenges to the workforce is that it can be seen as being more work, another thing to do when you've already got a full list. But in reality, it really makes people's work less in the long run. So it's sort of like prevention work that we try to make sure to invest up front because it'll save at the end. So just getting people to understand that is important so it's not seen as one more extra thing. And I don't think that recovery is understood by the general public either. The perception of people in our care is not always favorable, and we really need to focus on correcting those inaccuracies and presenting people in their truest light. So that's definitely a challenge that I've seen.
Yeah. I hopefully some conversations like this will help illuminate, the
Yes.
work that you're putting into it. But I do want to talk about the workforce matter. You said that it may look like extra work to the people who are at the front line of care. So as New York integrates recovery and resilience into its mental health system, what would you say staff need most in order to truly support recovery and resilience?
We are living in a difficult world. Staff wellness has been a focus of ours, and not just their wellness at work, but their wellness in their lives. I think that, it seems people are under more pressure in general, more stress, more worries, more uncertainty about the future, more judgment. You just keep adding on those stressors and difficulties for individuals. And then they go to work and they're facing stressors and difficulties there. So we've been very much aware of that as an agency and have taken steps to support individuals as far as wellness activities or wellness areas within our hospitals, ensuring that we have good employee assistance programs and that people are aware of those community resources for whatever needs they may have at home. People who are tired, stressed, and overworked, it makes it hard for them to have hope and, really invest in others and try to do something that they see as more. So trying to make life easier or at least take away some of the pressure, some of the stress is important. And then I think making them or allowing them to see and connect to individuals as people as much as possible really helps for them to see how this work is important.
Yeah. I'm glad you mentioned that because as you were sort of touching on, there's a lot of pressure for people in the mental health workforce from, the shortages and providers available and burnout. So it's great to know that you're trying to also take care of the people providing the care. Going back to the patients though, or the people who are, trying to recover, when you think about recovery and resilience in mental health, a lot of times people may think of, recovering from a substance use disorder, opioid use disorder. But what does a good outcome actually look like, not just clinically, but in terms of quality of life for someone recovering from a mental health condition?
You're absolutely right. When we say recovery, the first thing that comes to most people's minds is substance abuse. But I think that there are some similarities in that when you're in recovery from substance abuse, you're sort of free from the chains. And I think of it similarly for people in recovery from mental health. They're sort of free from the oppression of their illness. It doesn't mean that they don't have symptoms. It doesn't mean that they're, cured. It means that they are living their best lives despite having this, as an issue, just as we would if we had high blood pressure or any other medical diagnosis. You don't stop living and all of a sudden just identify with that diagnosis. You live your life around it and make accommodations where you need to. So the idea of people living their best lives, people thriving in life and not just surviving, being identified by their characteristics, their talents, their personal qualities, not just their diagnosis or their symptoms.
I like that. Thriving, not surviving. So, we've talked a lot of big picture about what recovery and resilience means, looks like. But what kind of programs or support do you see making the biggest difference in helping people thrive in their own communities?
We've had a lot of great programs that we have either run or sponsored by the agency, and they're really effective. I think the ones that tend to be a little more out of the box, I appreciate because they meet the people where they're at, right? So like an ACT team, that's really sort of a mobile clinic where they have a prescriber and a clinician that will come to your house if you're not yet able to come into the clinic. Or we have mobile integration teams that do outreach and engagement for individuals. So all of those things are so important. But I think equally important is building the natural supports in the community, equipping the community to be able to handle some of these issues and understand what people are going through, family or friends, to be able to care for and support each other. We've had several programs that aim at that so that the general public can be more aware and be able to intervene as appropriate. And then also supporting the self-help groups or the groups that are meant to provide support to individuals. I love our formal services, but I don't love the idea of a person relying only on people who are paid to care for them. That to me is sad. So really building up those natural supports has been something that I've really focused on.
Yeah, that makes a lot of sense too, since in order for people to thrive, they need to really feel connected and lean on their family, their friends, the people around them, not just their providers.
Right.
So that makes tons of sense. I feel like to have this perspective where you believe in recovery and see it work, it requires a lot of empathy. So, where do you see empathy showing up in your leadership approach, and how do you cultivate it within others in trying to make recovery work in action?
I have to have empathy in order to have hope and faith that this is going to be effective and worthwhile and work, right? I have to understand what it would be like to be in the other person's shoes, to know what we should be striving for that person. And I often remind myself that I could very easily be in those shoes. I could very easily be on the other side of the desk. There's not any magic that makes me different from the people that we're serving. And it could be my mother, it could be my brother, it could be any loved one receiving the services. So treating people with respect and understanding and treating them as people is just so important. And I think getting to know them and understanding their behavior and what's behind it, understanding trauma, understanding their interests and their lives that they lived before this illness consumed them helps people to relate and to empathize and to connect. We've had amazing stories where people have discovered that individuals they were working with for years had a job that they had no idea, professional chef, or the person is incredibly crafty and was able to knit or crochet amazing things. And it's not a criticism of our workforce by any means, but when you're there to treat a problem, it's easy to focus on the problem and to forget the rest of the picture.
Yeah. Speaking of connecting with each other, I also wanted to mention that you recently hosted your first recovery and resilience event. Do Do you like to share a little bit about, how that went and what some of the takeaways from it were?
Yeah, sure. That was focused on our state operated facilities, and it was intended, it was the first annual recovery conference, so we'll do it every year. It was intended to kind of present some new ideas, also celebrate some of the work that has been done, and inspire our workforce to look forward to doing more creative things. And I purposely invited a mix of staff. We had everybody from executive directors to direct care staff to clinical staff to peer specialists. And I think that added a nice element to it so that that wasn't just the leadership pushing down. You really need to feel these things sometimes. You need to be sitting in the room with each other and, sometimes getting those goosebumps when something really hits. It's hard to relay the message. I think, we have to try to do that as well. But having everybody in the room and really being inspired by some of the speakers and also the facilities, the hospitals had done recovery projects and presented a prepared poster presentation. So we had them around the room so everybody was able to see the work of the other hospitals and celebrate that progress and also be inspired by some of those projects.
Definitely. I know that this position is still relatively new, that you've had your first conference. There's a lot of fresh stuff on the ground now that you're putting forth. But when you imagine New York's mental health system 5 or 10 years from now, what would you hope people say about the experience of getting care?
So I know there's always going to be a need for professional services. I just hope that they become a little more everyday, a little more integrated into society, less mysterious, less stigmatized. I hope that there are more and more people who can support individuals so they don't have to rely solely on those paid supports. Kind of going back in time a bit where we really leaned on each other when we needed assistance. I'd also love to see more acceptance for people who are a bit out of the box and not trying to, not being so afraid or judgmental. But I think that acceptance comes with exposure and connection and some of the, correcting the misrepresentation of individuals and having to really push those positive stories and present the strengths and the skills of individuals to combat that negative publicity that we see so often in the media. So I think that, the 5 or 10 years from now, the services would still exist, but they wouldn't be, sort of in a silo. There's your clinic over there. Now go back to your life.
Yeah. And it goes back to what you were saying about, how we need to equip more people in our community broadly, not just the providers, so that, people can feel supported and recover in all corners of their life.
Right.
Is there anything else that we didn't touch on today that you wanted to share, Julie?
I just hope that I appreciate you inviting me to speak. And I do hope that it's one of the things that helps make a difference by, presenting this work. I don't think a lot of people are aware of it. I don't think a lot of people understand what the agency does. So I do appreciate you reaching out and wanting to publicize this and wanting to share the fact that people can recover from mental health issues and learn to live their best lives, and that maybe somebody who's not struggling with this will get a little bit more of that empathy and understanding and maybe help somebody out and help them along on their recovery. We interact with people in so many different ways, whether it's the grocery store or a church or a club. There's a million different opportunities to make a difference in a person's life. And I hope that more and more people take that. I was walking the other day and it really just hit me how everybody had their headphones in. Nobody really connects with each other in the way that we used to. I mean, if we didn't have the headphones, we would be saying hello, how are you, and have those incidental conversation. So I do get concerned about that separation of connection and humanity toward each other. So I hope that people remember how important it is to connect and be kind to each other and try to be supportive. You never know what somebody's going through.
Exactly. Especially now around this holiday season, it's a good call to action. I think it'd be good to our audience to make sure to reach out, to stay connected, to smile, to be kind, to be empathetic. So I really hope that folks do keep that in mind and really absorbs it in a great way through this conversation. Julie, it was such a pleasure to have you, and best of luck in continuing what you're doing.
Thank you so much.
Julie's work reminds us that to recover is to be human. It's about seeing a person as a whole, their strengths, relationships, goals, and potential, not just their diagnosis. I'm also reminded that resilience is something we continue building throughout our whole lives, and that the people providing care need compassion just as much as the people receiving it. As we move into a new year, a time that can often feel heavy or lonely for so many, Julie's reminder about connection also feels especially important. Recovery doesn't just happen in clinics or programs. It happens in the small moments when we choose to notice each other, check in, and offer kindness. So, as this new year unfolds, I invite you to take one small action, like Julie just mentioned. Look up, say hello, and reach out to someone who might need a friendly face, or simply make space for someone's humanity. It matters more than we often realize. With that in mind, I hope you enjoyed today's episode. Make sure to like and follow wherever you get podcasts, and share this episode with a friend if it made you think differently about how we approach mental health. Thanks for tuning in, have a very happy new year, and I hope you'll join us next time. Thanks, y'all.
Empathy Effect is a product of Forrest Marsh. You can reach us at forrestmarshmedia@forrestmarsh.com with any feedback, questions, or inquiries. If you want to know more about today's guest, are interested in participating with Forrest Marsh, or becoming part of our community, check out our show notes for more information.